So give us a little bit of overview about the currently right now. You mentioned that, you personally, if there's an emergency, someone's having a heart attack, you know who to call, you know how to stabilize them. An overview of the things that experts should realize when they're moving here. And I know there's certain conditions that are a bit more sensitive than others. What would be those conditions that you would recommend expats that, before you move here, make sure that, your plan of action if something does happen, how much will it cost you and so forth?
Okay. There's a lot of people who come here and just have not thought things through, not just medically, but overall. And medically is, they get here and they're like, what were you thinking? You sold everything there. You didn't investigate.
Oh yeah, Job and I see it all the time.
We see that all the time.
I'm dumbfounded. And all the more so, if you've got a lot of health issues, all the more so you should be knowing, okay, can I get my medication there? Because remember, we're a small country. We only have 400,000 people. There's more people in one building in Chicago than there are here. So the types of medications that we can get in are limited because the supplier has to pay a fee, a licensing fee for each product that's brought in. So we can't get everything. If you've only got one patient on it or 3 in the entire country, who's going to bring that in?
Right.
Well, there are ways to do that. There's certain things that can be special ordered, through suppliers, but it can take time. It can take, a couple of months to get it in. So first of all, everyone should come down with at least a minimum of 3 to 6 months of their medication. They really should, before they come down, is sit and talk to a doctor about what is available, what isn't available. What do we have that's comparable? So this isn't exactly. And then I always encourage them, bring me the list. I go through it. I review it with our pharmacist. And then, we say, okay, this is kind of equivalent. Talk to your doctor back home because they're the ones that know you and have that history, and see if they think that this would work for you. Right. Would that be a good alternative? Or is there something, because everyone's different in our chemical makeup. So what works on me might not work on you, and what works on you might not work on the next person. Right. So we have to, it's very individualized. And then, there's people, if people are on high opioids or have ketamine treatments or infusion treatments, they really have to come down with that amount of medication. We have a very limited amount of opioids that come into the country, and they're highly controlled. If you are getting them from a proper supplier, yes, there are black market stuff, but those aren't necessarily the proper quality.
Right.
If you get the tablet and it crumbles in your hands, that's
not a good sign.
Yeah. So, can people get things through the back door? Yes, but it might not be the quality, and it's going to cost a lot. Right. So people are on high opioids. That's a really difficult thing to get here. Specialized inhalers are difficult to get here. Some of the specialized drugs for people that have autoimmune diseases, or even like ulcerative colitis, or a lot of the things we see for commercials for Rexulti, we don't have that here. Right. So people with mental health disorders, you're fine-tuned. Once we get you fine-tuned, we don't want to mess that up. So you don't want to change that, because you can change the stability of the individual. And so those are complicated ones. And then you've got people who have to, for health conditions, need to have their blood let every 30 days. You can't do that here. We don't have a blood bank. So we don't have a way to dispose of the blood. It's regulated by the blood bank. So when we kind of talked about this before we came on camera, but only government facilities can have a blood bank. So at the polyclinic, when they do the blood drives, what's happening is that people from the blood bank in Belize City are coming over, and they are, so that the chain of custody of the blood has to be set. The blood has to be kept at a certain temperature. There's a lot of regulation that goes on to it. It's more regulated here actually than in the US, believe it or not. It's not, that's a complex issue. We had somebody in the clinic just the other day saying, but why can't I? I was told that I could. And I'm sorry, you can't, we can't. Mm-hmm. I do know some people who do it on their own because they know how, and they dispose of the blood in their own way. I frown on that because we really should keep within the standards. Right. Mm-hmm. But some people are going to do what they're going to do. That's a biggie. The hemochromatosis can be a really hard one for people, because they really should let it every month, and often they can only do it every 3 to 6 months. Oh. And so then the blood builds up in their system because they're making too many red blood cells. Yeah.
Interesting.
Yeah.
And so we have also a lot of experts who come in, and I've had this question asked about me, and I probably should have reached out to an insurance company. But what does health insurance for overall locals and experts, just overall health insurance looks like for people here? Because I know that's a big thing back in the States.
Yeah. So in Belize, we have Sagicor Insurance and RF&G that have health insurance. But for that, even local, you have to go through a medical physical. I'm actually a Sagicor doctor that does the physicals for people, whether they're getting life insurance or health insurance, any of that. And so it's a pretty extensive physical. And then when you are approved for the insurance, you still pay out of pocket. And then you get reimbursed. Mm-hmm. Now, if it's something that's larger, like a surgery, an elective surgery, say a hysterectomy, you have to get an estimate from where you're going to have it done, and it has to get sent to the company and has to get approval. Mm-hmm. And then they work out the payment from there. Mm. There are, like the private hospitals usually will work with each individual. If there's, a really huge complication and they can't pay it all up front, they work out. They will work with each individual. I reached out also. There's one of the facilities does accept Blue Cross Blue Shield, but I didn't get to speak to the admin about how that is done. So they need to plan to be able to pay.
These ones are American-based insurance?
Yeah, Blue Cross Blue Shield is.
And I can talk about two as well, because I have an international health insurance. So there's BUPA, B-U-P-A, and Cigna. And so when you're putting in your application, you have to show proof that you're living in another country, what country you're living in, and then you can choose the plan that you want. And then you can typically, depending on the plan, if you want to add coverage in the States as well, you can. If you do that, it will have your premium skyrocket, because health insurance in the States is ridiculous. But you can add that. Or if you're just living here in Belize, like, you know what, I don't plan to go up to the States, I don't think I need it in the States, you can get a specific plan for that. And it's just like you were saying, you have to reimburse, essentially. They'll reimburse you your expenses. And I was going to Belize Healthcare Partners in the States, or in Belize City for a little bit. And so they accept the insurance, but I still have to fill out the form, had to get the estimate of how much I thought that it was going to cost. And then they would basically say yes or no. So It's definitely a process, right? It's definitely a process, and I know sometimes you get people like, "Oh, can I use my Medicare or Medicaid here?" No, this is not the United States. And if you want to use that, you stay in the United States. But it is possible to have an insurance here. But it's also very affordable. Like, how much is it to see you for just a general checkup session?
69 Belize.
69 Belize dollars. So very affordable, I think, too. Where in America we think about how expensive healthcare is because they have, like we were talking about, the malpractice insurance. So with malpractice insurance, it generates really, really high dollars for just general checkups and whatever that you need. But I think sometimes people really are shocked when they come down and living as an expat and they see, oh, I can do this for, fairly affordably compared to what I would have paid in the States.
Yeah, like when I had both my children were emergency C-sections, and my sister was pregnant around the same time, and what I paid cash for the hospital stay, because I've got not so good a heart, and so it was a little complicated, and they were both emergencies, so the babies had complications. So for everything, including pediatrician, it was less than what my sister's copay was.
Wow.
Yeah.
I have heard of that, and that comes to touch in one of the things too as well. When it comes to the medicine that is available here, comparing to a medication that I'm drinking now, comparing to what one of my friends takes similar, it's a lot more expensive in the States than it is here. Would you say that for at least the medication that's here, it's reliably cheaper than in the States?
Generic, yes. Name brand can get spendy, but it's still cheaper than in the U.S. But what happens for most people in the U.S., they usually have a copay, so they're only paying $10. So then they think the medicine here is really expensive because they're used to paying $10. Right. And in actuality, if they were to see what the insurance company charged was charged for it, it's
a lot more.
A lot, yeah, huge difference, yeah.
Okay, all right.
Yeah.
So now you mentioned a topic when you were talking about medical issues, emergency response here in the island. I mean, it wasn't until recently that we literally got 2 ambulances, right? A private and a donation base.
Right.
Yeah.
From your standpoint of where you're working right now, how do you see emergency accessibility and cost? Because if you need to be transported to Belize City for something major, do you have an idea of what that? And I know where you are now, which is the San Pedro urgent care. You have accessibility to like helicopter to be able to be flown out to Belize City. What does that look like in cost, if you have an idea?
Well, yeah, so I think that the helicopter is actually Astrom helicopters, and so you'd be chartering Astrom helicopters, okay? And my understanding has been 10,000 US, okay? Now, there's differences between day and nighttime. In the day, if you can get out, so I always look at people, if by 3 o'clock I don't have somebody stabilized, I'm getting them out because we've only got 2 hours of daylight. So I need to be able to arrange for transportation, air flight, and ambulance on the other side and somebody else on the other side. Once it gets to 4 o'clock, I'm starting to get really nervous because if they're stable enough to go on a tropic flight, that's perfect. If we have to get Wings of Hope doesn't fly after certain hours. Wings of Hope during the daytime is, I think it's between 1,000 and 1,200 Belize, and after hours, it's, I think, 1,800 or 2,200.
Okay. We won't quote you on those numbers.
Yeah, so it's but roughly. Now with Wings of Hope, there's a paramedic on board, and then they have room for one person. So one person can go with. So ambulance, transport to the airport, to the plane, to the municipal. Thank God municipal's got lights now, because before we had to go to international. So that was a huge expense because they had to open the whole thing. And so with that upgrade, that's a huge savings. And then ambulance there and going. So there's some hospitals that'll allow you to put the ambulance onto your hospital bill, and other hospitals that don't, so you have to pay the ambulance up front, but they do take credit cards.
Okay.
Yeah.
All right.
And then if Wings of Hope, because remember, we've only got one Wings of Hope. Mm-hmm. Let's say it's down in PG. Mm-hmm. Well, now you're going to need to charter a Tropic or a Maya plane.
And just to confirm, so Wings of Hope is an air
ambulance.
Okay,
yeah.
That covers the whole country, though.
Yeah.
Okay.
Yeah. And so there's only one pilot. Uh-huh. And again, it's more. It's private but subsidized.
Got it. Okay.
Yeah.
Okay.
Mm-hmm.
Got it.
All right. And medical base wise, the services that have you seen from, because one thing I mentioned was in 2020, COVID came and it tested, and it's the healthcare system here in San Pedro, especially here in the island. You remember how you had to go get tested, and the whole,
I think people got COVID from waiting in line to get tested.
I think so too.
I remember I had to go once, and I was like, yeah, this is not, let me just stay home. But what, from 2020, you mentioned that the country, I would say, in the background, all the associations, that they made major progress in improving the healthcare system. How have you seen, when it comes to the actual day-to-day medical and doctor accessibility in hospitals and specialists, have you seen Belize going in a trend where it's improving overall?
Yes. 2020 really highlighted the holes in our healthcare system and the instability of supplies, and it just highlighted a lot of things. And also during that time, I think there was the realization that our specialists are getting older, and we need to start replacing them because they're going to start retiring, or they die from COVID or things like that. And so since then, there's been a lot more scholarships made available for GPs to be able to go and specialize. And so there's a lot more people coming up. Like before, we didn't have any psychiatrists in the country. Now we've got 3 or 4. And we had only a few urologists. Now there's a lot of urologists. We only had a few neurologists. Now there's people who are working on specializing in that. It takes a long time to grow a doctor.
Right.
Right.
And so like for the system that I went through, it's 12 years of education. And what they go through in Central America is 6 years, because they don't require a bachelor's ahead of time. So you can't just snap your fingers and say, let's get more doctors. It just doesn't happen. And then getting those years of experience, I think that's one of my frustrations is that somebody will say, well, I've got what everybody else is having. Well, actually, no, you might not, because it could be something. You want me to explain to you 20 years of knowledge in 2 sentences? I can't do that. You're just going to have to trust me. We need to test your stool, or we need to test your blood in order to see if that's indeed what it is. So 2020 really highlighted that. And so there's a lot of people that I was GPs with, they're, of course, obviously a lot younger, and so they've gone off to study. And the one doctor that was at Polyclinic went and did pediatrics. They're now back, and so we have another pediatrician, internist, radiology. So there's a lot more people who have gone to specialize to start helping to replace those who we've lost, not just because of COVID, but because of age.
Right.
Yeah,
So,
absolutely.
yeah.
And when you say they go off to study, where do they typically go?
Well, there's the last one that was just put out. There's one, of course, a lot in Cuba. Mexico does offer some scholarships. Guyana just offered scholarships, and then Costa Rica and Nicaragua have offered scholarships. So, and I think that's one thing too that's nice about the BMDA is that now we're getting access to more information. Other countries are realizing that we are wanting, to increase our services and develop. And so that is, if people don't think you want it, they're not going to offer it.
Absolutely.
So now that they know that there's a desire, we're getting more things offered. So that's a really good thing.
That's great.
Absolutely, that's
Yeah.
great.